Hey guys, it's Mike Fazio, and I'm going to go ahead and give my presentation for the final on human security in Alaska, mainly focusing on health and health security. So the community that I went ahead and chose was Napaskiak, Alaska. This is in southwest Alaska, near the Bethel area, and it has a population of about 410 people. This is a central Yupik area that's been around. It first appeared around the 1880s and then reappeared 1960 when they started to get more members or community members and kind of become larger. They live right along the Kuskokwim River and they live a very basic subsistence life. This means fishing, hunting, and gathering for most of their necessities. And like most of the villages or communities in Alaska, this is only accessible by plane or boat. Boat is only in the warmer months of the year, and plane has to be most of the time, especially when we're talking about medevacing people out for medical emergencies. So to start off, what is health security? One of the great organizations, the World Health Organizations, does a good job of giving a standard definition, which is global public health security is defined as the activities required, both productive and reactive, to minimize the dangers and impacts of acute public health events that endanger people's health across geographical regions and international boundaries. Now, it's quite a definition, but kind of a simplified version that I thought of. If you really just needed to sum it down to the lowest possible thing, it is the protection for and the prevention of threats to a person's well being and that of the ones around them. This means the community members also. This is not just a single person problem. Health security deals with a large group of people because, as we can see, it's much different living in Alaska than it is in the rest of the country. And then even before that, it's much different to live in a village than it is to live in just a urban part of Alaska. Go back. All right, sorry. So then we have our metrics here. The metrics I went ahead and found, basic things that can kind of overview or tell a little bit about our health security in a certain location. First off, we have life expectancy. Uh, National average for life expectancy is around 78 years old, can go a little higher depending on the state. But here in Alaska, it's around 73, and goes lower for these outer communities where they don't have a very large access to the resources that we do. And like I said, urban areas or places that have hospitals close by. That goes into the third point of number of hospitals. The number of hospitals a location has normally increases the overall rate of security for a group of people. They have closer reliance on if they have a medical emergency for people to go to. Whereas here in these outer communities in Southwest Alaska, they are required to actually fly out to places like Bethel, and then from Bethel, they may even have to fly out to Anchorage. I also went ahead and put on there rate of sexual assault and alcoholism because it's not just, we talked a lot about that in community security, but it really does affect the overall health of a community. Alcoholism, as I'll go over later, there's large numbers of deaths just because of that. Injuries to self or others through violence and homicide. And then also sexual assault, which I've kind of posted a diagram over here for both. Alaska sadly is, gotten the phrase or the term coined to it as the rape capital of the U.S. Its rates are higher than any other state, and it's about over twice the national average. It's something that, it affects the women mainly physically, but it also does, affect them mentally. These are both things that are relative to health security, and they truly need to be addressed because the numbers have only been going up. And then also we have mortality rate. This is just up to 2013. I know the number has risen significantly with COVID and people not being able to get out and do the things they normally do. But we look in the area where we have our community, and it's the second highest in all of Alaska. The Southwest is truly by the water. Some of these communities are dry, some of them are damp, and some of them are completely open. Um, the more open they are, the bigger of a threat we're going to see alcohol and substances like alcohol on the community's health security. And then finally, I went over COVID 19. I went over a little more in my paper, but COVID 19 in places like this community, we see a big problem in the beginning where they had two or three people get the cases, and it was kind of scary at first. And so communities and organizations kind of took action very quickly to combat that because they knew this would be a much larger metric if it would have gotten out of hand. All right, so now I have root cause analysis. This is very basic, and it can go a variety of different ways depending on the person. Um, but it's kind of a four-tier list, and from what I got from it, I had first, what's the problem? What are we seeing? And what we see is that people are getting sick and they're dying in significantly high rates, much higher than the US, and, urban locations in Alaska like Fairbanks and Anchorage. Why is this happening? Why are they dying? Why are they getting sick? Of course, we have a large number of illnesses and a lack of help from the outside. You know, they don't have hospitals, they don't have, people coming in, government organizations to give them the assistance they need immediately. Why is this happening? It's their distance from urban areas. Since they are not close enough to these places, um, you know, even close enough to Bethel, which is about 7, 8 miles away from or downriver on the Kuskokwim River, uh, getting up there just to their medical location. And then from there, depending on the severity of what's wrong with them, they need to go to Anchorage. The further away you are, the higher your health security is going to suffer. Now, why are they so far away from these urban areas? I mainly chalked it up personally from what I researched to lifestyles. Of course it is their, option, but this is also where they grew up. This is where their land is. They shouldn't have to move. And so if their lifestyles where they live is being a problem, what do other people need to do? What do organizations need to do? How can they step in, help, um, and make it so they can live where they're supposed to live without being in fear, constant fear? How can they live in dignity, as the human security model goes? A little further into root causes, because obviously it is not just where they live. I said it's because of lifestyles, but it's lack of outside help. We didn't see a large number of people stepping in for help. We saw a couple coming in, native organizations and government assistance back in 1978 and 77. Um, but other than that, we see problems that aren't, even if they do step in, people are always going to have to go out for some form of medical help. The amount that they are priced for some of their medical costs is extremely high, just like everything in Alaska. But when you have to go ahead and fly out and it costs, $100, $200, that's quite expensive for a community that's income is below $50,000. So somebody that has, a severe illness or a chronic illness, let's say cancer, or they're elderly and they need constant care from medical providers, they're going to be flying out, multiple times a year, maybe even multiple times a month. And so it's really hard to live off of the small income that they already have and still provide for their medical necessities throughout the year. And to kind of support that up, This is from Primera. They did a little study. This is around 2014, 2015 on insurancer payments to providers. Now, on the right hand side, we see the nationwide. This is where we see in most places. We can count most of the lower 48. And then we go to Alaska. And this is huge. This is, when we just look at hospital visits, you're looking at a rate that's about 100 to 200% higher, especially for the total. The total sits at 200 flat, but now we have a total that's about 350% um, that's going towards the providers. And how are we expecting these, residents, maybe people in Fairbanks and Anchorage can make off a little easier because they have high paying wages, but the people that live in Niskakwim, they rely on their subsistence living. They're not going to make a wage. They're going to survive and live in their natural communities or their respective communities. And so this is not something that they can expect to pay. They're not ready for this, and it's quite high, seeing as they don't have those medical services where they're at. They don't have access to them. They have to leave to go get them. So it should probably be dropped to better help them survive. Obviously, vulnerabilities, we're going back over it again. Those costs of services are extremely high, and the cost to get to those services. The community threats of if you have an immediate emergency, where we could go here in Fairbanks down to the local clinic, or we can go to the hospital, and it's going to take us, probably no more than 15 minutes. That's a 15-minute max. Whereas if somebody has one of those life-threatening illnesses or conditions, it's going to take them, sometimes an hour, maybe more, before they are even seen. And it's the ability on the part of the community. What are they doing? As we discussed earlier, the alcoholism rates, that influence the assault rates and the sexual violence rates. Um, how are they at risk of those? It's how much alcohol they're allowing into their communities, how much is being consumed. It's one hard thing, in a community like this that's so small, to find exact rates for them. But the rural community as a whole is very susceptible to alcohol, and we already see that the effects of it do cascade down onto others. Talking about a cascading effect, the overlap, because health security, we often see that, other forms of security affect health security, but it's also vice versa. Health security does affect these different categories of security. Biggest ones, obviously, are community security and personal security. Personal security is dealing with yourself and, what can you control as far as your health goes. Um, when we go into the community, though, if one person is healthy, that's something. But if we start seeing, a large number of community members getting sick, then we have a problem. So health security never really does start at the personal. It affects the personal, but it is a community problem. If the community is not addressed and they're not taken care of, then we're going to have multiple people getting sick, multiple people having illnesses dying, mortality rates rising when they don't have to. A good example of this is COVID-19 and their response. They saw the community was in danger, and some of these organizations actually came forward and said, no, that we're not going to let that happen. And they now actually, as of August, have been providing free testing for the community members. And so the couple of cases they do have, they've now announced um, the World Health Organization in partnership with the Yukon Kuskokwim Health Organization that they are no longer in a situation of like constant spread. Finally, we have economic and food security. These are a little bit more of a stretch, and normally economic and food security affect a person's health. But in this case, if a person's health is not up to date, if